Our discussion today is being brought to you by the Michigan Mental Health Counselors Association. I'm Dr. Larry Pfaff, and I will be hosting the discussion. We have two very interesting guests. One is Chris DeBoer, who is the president of the Michigan Mental Health Counselors Association. The second is Shahkarami, who is a member of the Texas Board of Counseling. They're just going to have a discussion about issues in mental health care around the United States and how it may relate to the Counseling Compact. I'll let each of them introduce themselves, and then we'll just take it from there. I hope you enjoy it.
Hi, my name is Shahkarami. I'm from Dallas, Texas area. I am a public member on the Texas State Board of Examiners of Licensed Professional Counselors. And my background is in healthcare, investment banking, and mergers and acquisitions. In mid 2023, I started my own company called Opelio, where I worked as a negotiator between providers and insurance companies on their reimbursement rates to try to get them more, not just higher, but for the insurance payers to develop better relationships with the providers and to actually pay the providers based on the value that they're bringing to their networks was the ultimate goal and mission. And the thought behind that was if there's better, more efficient relationships between providers and payers, we could reduce waste and create efficiencies to ultimately lower the cost of healthcare in the long run. Now, it just so happened, I think, because of my background in performance and psychology, I'm also a published author. 60% or more of my clients were in the mental health space. And a lot of my work is what helped me get my board appointment. And over time and through my research, I realized there is a concerning vertical consolidation of the mental health industry. And what I mean by that is the insurance companies are purchasing ownership interest in large, sophisticated online platforms such as Headway and Alma. And through those investments, through the ownership of these online platforms, they're really taking control and setting the price, the reimbursement rates of the market, and by having that much control, perhaps even monopolistic control, it's driving down the reimbursement rates for mental health providers in some geographies where it's very hard to run a practice and have sustainable profits. So it's kind of an alarming trend that I'm trying to ring the alarm bells on, and happy to be here to discuss this in more detail.
Thank you, Sean. And so my name is Chris DeBoer. I'm the president of the Michigan Mental Health Counselors Association. Also, I have been a practice owner in the private practice space. I did that for about 5 years before we uh, merged with another local practice because of some of the things that Sean was speaking to. Um, but my background comes from I did my education in prior to counseling in political science and policy, and so this has always kind of been a space that I've been pretty aware of. Um, Several years ago, I kind of began ringing the bell on uh, ownership by private equity and venture capitalist firms in MHCA, Michigan Mental Health Counselors Association, and being worried about things like BetterHelp, seeing them pop over all the advertisements on YouTube and kind of be suddenly shoved into everybody's face really aggressively. And to me, that always kind of brings up alarm bells. Um, so I began paying attention to this. And one of my other experiences as a practice owner was a lot of private equity firms contacting me about acquisition. Um, so I kind of saw that vertical integration kind of firsthand with how aggressively some of those companies would pursue me in my practice. And to me, when I decided to get out of group practice ownership, it was actually really important for me to um, merge with someone that was part of my community, right? Because I'd heard the stories about what happened to other places that got acquired. And so, that's some of the reasons why this is really important to me. And obviously, um, this is an important matter to counselors here in the state of Michigan. And so uh, we ran across actually a video of Sean in a Texas Board of Counseling meeting and hearing them talk about the compact. And he brought up vertical integration and some of the issues with venture capital. And like a light bulb went up above my head, and I was like, there's someone else who is seeing this and is concerned from it from like a larger systemic perspective of the market in the field. And so we reached out to Sean and wanted to set something up, a discussion, because a lot of people in mental health, this is not what they pay attention to. They're much more concerned with their clients and the interpersonal and the one-on-one. And it's beautiful for what we do, right? It's necessary. That's what our perspective is. But it's also important for us to be aware of kind of the systemic factors which affect our profession, affect the relationship we have with clients, and the quality of care that they receive.
Mhm.
And
It does.
so
Yeah.
that would be my little intro, I guess. So I know what I had heard you kind of come into this discussion, or what initially like kind of perked our ears, Sean, was you talking about the compact and what it would mean to the state of Texas. And so, I'm kind of curious for you, what's your idea on that? I know you're not against the compact necessarily, but you did have concerns. And so I was kind of curious if you could talk about those.
Yeah, I think that's a great starting point, and I appreciate you bringing that up because to be perfectly clear, right now, to my knowledge, from what I've been told, is there's no data on the compact. So I cannot have an educated opinion on something that has no data. So I don't consider myself for nor against the compact. I think what I was trying to bring to light, though, is a medical triage situation, right? So in triage, if you go to the ER and you have multiple things going on, let's pretend one is a open wound that's bleeding, and you have a sprained ankle. The the medical professionals are going to treat the open wound that is bleeding first. And that's kind of how I look at the vertical consolidation in light of the counseling compact. Because right now there's no data for the counseling compact. I believe there's 37 states, but it's not really turned on per se.
It's not in effect yet. Yeah.
It's not in effect. But what you do have in effect already turned on is these large platforms, which I don't want to take anything away from people who are visionaries, from entrepreneurs who take risks, and build something of quality. So there's some, there's pros and cons to almost everything. But these online platforms, and I'm going to specifically speak to Headway and Alma today, and I'll tell you exactly why, is they have direct ownership interest by the insurance companies, along with the venture capital groups that and private equity firms that you mentioned as well. Um, I think both are bad for healthcare and mental health. I do think, in my opinion, from a triage situation, I think the insurance companies having direct ownership of medical and mental health providers is a little bit more alarming than purely private equity. But it's not that big a difference either. They're both, in my opinion, not great for our healthcare system. And one of the things that's been difficult, and why I think I appreciate someone like you with your background in political science and policy is you're an ally who can help me better explain just stuff that mental health professionals and for that matter medical doctors as well
Hmm.
just don't the knowledge isn't given to you as part of your normal education to become a licensed counselor or in case of medical doctors become an MD, which is how the ownership of entities work and what it really means when the insurance company owns these platforms. And it kind of, like you said, falls in the background because you can't really see it. And one of the other troubling things that makes it even more complex is the structure and the sophistication of the insurance companies and the private
Hmm.
equity companies as well, but of the insurance companies themselves. Because, for example, um, the tragedy of what happened to the United Healthcare CEO, right? However, what a lot of people are now waking up to is the fact of United Healthcare is owned by United Health Group. And underneath United Health Group, they also own Optum. And Optum is the largest employer. They employ over 100,000 physicians in the United States. They're the largest employer of doctors in the United States. You, as a mental health professional, probably know of Optum because Optum is actually the payer of mental health. United Healthcare, when you get paid by UHC, it actually says Optum.
Yeah.
UHC doesn't do the mental health. Optum is the mental health arm. Well, they have another group which is owned by United Health Group called Optum Ventures. And Optum Ventures is their private equity arm. And
Yeah.
so, what I'm trying to bring to light is these insurance companies are operating as sophisticated Wall Street financial. I mean, insurance is financial services.
It absolutely is.
So, and one of the other things to keep in mind is, and I'm not claiming that I know a tenth of what a licensed counselor knows. However, I will say business school, especially finance, because I have degrees in both accounting and finance, is a little bit more well-rounded because we are taught psychology, especially in finance. We are taught behavioral finance, behavioral
Hmm.
economics. We are taught psychology and management. And so these Wall Street executives know human psychology and know how to exploit it as well. And on the other end of that, so we spent some time talking about United Healthcare and Optum. Blue Cross Blue Shield may very well be a worse transgressor of direct ownership in medical and mental health. And they may actually employ more physicians, but it's hard to really know because the way that Blue Cross Blue Shield Anthem works is they are a state franchise under a not for profit. Um, they get the not for profit rights to use the name and the trademark of depending on the state, Blue Cross Blue Shield or Anthem. But then there are these large holding companies, some of them public. Elevance is one of the largest holding companies of Blue Cross Blue Shield Anthem. Um, state franchises. And the other one that I have been shedding light on is called HCSC. HCSC is not a public company, but it's very large. And HCSC is the holding company that owns and controls Blue Cross Blue Shield of Texas, New Mexico, Oklahoma, Montana, and Illinois. And I bring HCSC up because in October of 2023, it's public knowledge. I have links to it. They became the lead strategic investor. So they are like the lead investor in Headway. And that to me is a huge conflict of interest. And it's hard to track and trace it all because of how well and how sophisticated um, they put together their holding companies. And the other thing is, if you look at, so I've had some discussions with Watley Callis. I don't know if it'll go anywhere.
So wait a second. You said a lot, so I want to just make
Yeah,
sure that I go through
yeah.
all this
Please
too.
stop me.
But it's the problem of knowing a lot is that you want to get everything out, and it's been good to actually hear all this and learn from it. One thing I wanted to note is one of the issues with all these companies becoming basically the entire chain, right, of providers is that at the end of the day, all of these companies, the holding companies, private equity, the insurance companies, are all driven in some ways by the same doctrine. You had the emergency of like shareholder primacy, especially in the 80s, which, for those that are unaware, was an idea that pioneered by Milton Friedman, if I remember correctly, that the primary interest of a company is to maximize the return on investment for shareholders, and that is their sole purpose and kind of guiding ethic. And so when you mix that with the ethics of healthcare, right, I think is how you see the entire ecosystem of healthcare in the United States, for all of its good parts and bad parts,
Hmm.
I think is driven by that. And you see that too with hospitals are owned by private equity more and more and more. And
Hmm.
so their interest and their fiduciary duty under the law is to primarily focus on maximizing profits. So it's not about adequate care. It's not about the healthcare outcomes of patients. It's not about the well-being of their staff or their providers. It all boils down to that one element. And that's a problem for all of us because ethically we are taught that our primary motivator and our primary point is the well-being of our clients. And that does not naturally mix well with shareholder primacy. Um, I also wanted to speak, you'd mentioned, in business school you get taught psychology, and that's true. It's kind of funny as I talk about economics. Economics isn't a natural science in and of itself, like it's often presented, the market and what the market does. It's an aggregate of human choices and behavior more than anything else. And so it makes sense that you get taught that and that it's very impactful for your field. Um,
This also makes me think about the compact, though, Sean, because
Hmm.
if this compact is a way to license people across states, that there's a real incentive for those large places like Headway and Alma to really want to be behind that. And because it allows them to license people in many jurisdictions very easily. And it would seem that that would be a real positive for them.
And that's exactly why I said it's a triage situation, right?
Okay.
So, like, before we should, my warning is before we turn the compact on, we have to first figure out what we want to do with and where we stand from a public policy, from an industry perspective on the vertical consolidation. Because what you have, in fact, is already built entire national platforms, infrastructure, sophistication, technology already ready to go on top of public company dollars, like UHC, for example, is a public company, and um, billion-dollar marketing campaigns and budgets. So my fear is if we don't ring the alarm bells and the counseling compact does get turned on and 37 states turn it on, thankfully Texas is not one of them right now, there would be this really tragic, unforeseen, at least unforeseen by the providers. Because
Yeah.
this is not something where I'm blaming providers. I just think the providers are told one thing, and there are positives to the compact. They're told the positives, but they're not seeing this unforeseen circumstance. And if they were to turn it on, my fear is the consequence would be they would no longer, they're already suffering. It's already hard to compete with these online platforms. Chris, you spoke to that. And maybe what I'd like to hear is just, and I know it's empirical, I know it's your personal, but I'd like to hear a little bit more about your personal experience of having, sounds like a successful group practice. And then, these larger firms come and consolidate, and now it, more difficult to compete, right? And so you have to pivot. Like you're going to be okay. I get that, but you have to pivot and do something different. Well, what happens if they get so much control that there is no more pivoting? It's either join them or find a new career. Because that's what I'm
And
afraid the compact could turn into.
and I don't think just the compact will turn into that. Like, I don't want to dog the compact and make it seem as though that's the big focus. But I know one thing that I have brought up is, so what happens if, say, with these platforms, once they reach kind of a saturation, once there's so many providers working for them, and they have their contracts with with the insurance companies, right? And the insurance companies go, well, I have 2 million providers across the country. I don't need to contract with individual or group practices anymore. I have everything in-house. So I don't need to contract with, you know, Red Cedar Counseling or, this psychology group because we have it all in-house.
Well,
And
that's already happening. I know that for sure because I came across that in my work, not once, not twice, but multiple times. And not just in mental health, but predominantly in mental health.
yeah,
Mental health is kind of the last frontier. That's also why I'm so passionate about getting this out, is because guys, like when you talk about primary care, you know, 5 to 10 years ago, if enough primary care doctors had stood up and remained independent, it wouldn't just, you'd have some help. But for the most part, there's very few independent primary care physicians left. Like mental health is the last specialty that has not been fully rolled up.
and that was actually something that stood out to me when I don't know if it was in our first conversation offline or if it was when you were talking with the Texas board. It that stood out to me is that we are the last kind of bastion of independent healthcare because medical doctors, dentists, and many other and all the specialties are basically
Surgeons, all
rolled
the special.
under hospital groups or otherwise corporate practices of medicine. And I was like, crap, he's right. And it was scary to think about that because again, with that shareholder primacy aspect, um, that means that people aren't going to get the care that they need. They're going to get the care that the insurance companies want to allot to them. And you know, we one thing we know about businesses is they don't want to do anything more than they absolutely have to, um, and usually less than they need to.
Mhm.
And so, yeah, I mean, that's very scary to me because, I've seen I know a couple people who've been in practices who were purchased by different companies. I won't say their names because I don't know the liability on that. But a couple that were bought by large venture capitalist groups, and they tell me the culture here has changed. It's our the way that we approach clients and the way that billing happens and the way that care is allotted has all changed. And usually also it means that the providers make less because suddenly there's someone else to kick up all this money to, right? And the equity group or the insurance company or the platform in terms of BetterHelp and stuff, I want to make sure they get paid. And so there, there's a little bit they can do with the insurance companies by having preferential contracts because that's something I think that doesn't get mentioned enough is that insurance companies also give better contracts to BetterHelp and all these, they get reimbursed more than all the rest of us do. Um, and so they'll get, they'll get paid. And then as soon as that consolidation happens, the reimbursement rates are going to go down, right? Because they control all the supply of providers. And so
Right.
why would I pay the providers this same amount? Because I own all the access.
Correct.
And that's also one of my concerns with the compact is that as that gets broadened, say 40 states join it. And okay, so now they have the supply of 40 states worth of providers through these platforms. Well, the people I'm pulling something out of out of nowhere, Wyoming don't get paid that much. Um, but why don't we kind of balance it out at that level? Because they could be seeing people in, not New York, because they're not part of it, but Tennessee, Ohio, Indiana, um, and just leveling out the reimbursement rates.
Right, right. Well, and there's so many other aspects, and you've touched on so much. So number one, what's concerning is Alma. I want to use Alma for a minute because Alma has equity ownership with Optum Ventures, which is United Healthcare, United Health Group, and Cigna, and they also have contracts with Aetna. And I can tell you firsthand that all three of their contracts are preferable right now. So I'm not an attorney, but if that is not collusion, I don't know what is.
Yeah.
And the other thing about these online platforms is they're run similar to social media, meaning that there's an algorithm. And if you're a provider that doesn't make the algorithm happy, now some of this is just what I have heard from other providers because I'm not a provider myself, is for example, I think it's BetterHelp right after you're done with the session, their incentive, like you said, to make profits is to get the person to book their next session. And what they will do, I've heard, is either like listen in and use some AI or they have some algorithm and they'll be like, hey, would you like to book your next session? But they'll give you suggestions of completely different providers than the one you just had.
Yes. And can I go off on this for a second? Do you
Yes,
mind?
please,
Okay.
please.
So, and this is an interesting thing too, because they're set up as platforms, right? And there's some implications for that we can get into later or another time. But yes, there is that element of data privacy. We already know that these companies um, do not practice proper data security. Um, there's several lawsuits about several of these platforms having sold data to Facebook
Hmm.
and other big data aggregation companies. And so the sessions are private and confidential, but that's only because they don't. The process that happens there is they take the data that they either have listened into or aggregated via AI or whatnot, and they depersonalize it as per HIPAA, right?
Hmm. Hmm.
But the issue is that HIPAA is a very old law
Hmm.
that does not hold up to modern technology. And so it is fairly easy for someone with big data aggregation models to anonymize that data and then be able to apply it to a client.
Hmm.
Um, and so, there's the data privacy element on that, even just in third party. But then there's also the way in which it erodes the traditional and research-driven way that mental health is delivered, which is the relationship with the provider is the biggest element for treatment success. I don't
Hmm.
know. I should check to see if there's more newer research on that, but I know at least as long as I've been in the field and when I was in school, that was the idea. It's not the techniques, it's not anything else. It's the relationship with the provider that provides healing and improvement, right?
Yeah, and I know this is going to come from me as empirical. I think I'm a huge believer in counseling. and therapy, whatever you need. So when I started my business as an entrepreneur, you're facing a lot of risk, a lot of uncertainty. I put a lot of my personal assets in my business, right? So I started seeing an LPC for mindset and managing stress. Um, Anyways, I've been with the same counselor for nearly 2 years, and no one would be able to convince me to change because of our relationship and what she's helped me do as a business owner and also as a man. And I bring that up because if it wasn't for that long-term relationship, I wouldn't be who I am today.
Mhm. And I can tell you both because I've been on the client side, right? You know, counseling has brought a transformation for me in my life. Um, but also from what I hear from clients is you'll hear that specifically, and you'll hear, I'll work with somebody for quite some time, and we'll talk about something, and then I'll connect it to something that we haven't talked about for 6, 8, 12 months. And I'm like, well, how does that work with that? And they go, holy crap, I never would have put that into perspective there. And that was only possible due to the long-standing relationship. And so when you're just able to be like, oh, well, I had a bad session where this person told me something I didn't want to hear. Oh, I can make a session with Joe Blow, LPC. Oh, okay, yeah, I'll do that because I didn't like that feedback.
And it gets really dicey too because I have a background in forensic accounting and I understand that like there are cases, and it might be the minority, but I still think it's important to at least bring up, right? Is I know there are certain cases where someone is mandated by the court to receive counseling, or an LPC may be called to testify over in a custody, typically in a custody battle, right? And if someone is court ordered to see a counselor and we as a society want to believe in mental health, shouldn't we as a society believe in mental health as it is statistically proven to be most helpful, meaning that should someone who really needs who really needs counseling so bad that a judge mandates it, be able to skip from provider to provider just to basically check the box rather than actually do the actual work it takes to heal or transform?
Well, and I'll add another thing into this hypothetical too. So this person who has court-ordered therapy, a lot of the times they're going to come from lower socioeconomic status backgrounds
Hmm.
because of the way that poverty in this country um, also is kind of a precipitant for many mental illness or mental health conditions, right? The pressures and stress of poverty lead to those things. And so, and that leads often to a higher level of, engagement with the court system and the
Hmm.
legal system. And so we'll say this person, they have Medicaid. What happens when we vertically integrated all of the providers into the insurance companies who, for one, may be specifically for these insurance companies, like literally have these provider lists. But also they're not financially incentivized to take Medicaid. What happens to all of those people who have Medicaid and are being seen now?
Yeah, I can tell you what the vision is. Now, I can't prove it. I think it's just me putting together everything I've seen in my work and just understanding the data that you described and what the trends are going, along with some marketing collateral from the insurance companies and the platforms themselves. Is And this is actually not necessarily a bad thing, but we basically do have a one payer system. Um, and when you think of Medicaid, the insurance companies are already managing a lot of the Medicaid. It's called managed Medicaid, and um, it goes through state
Yep.
RFP processes, and but the insurance companies themselves will actually get the dollars and then distribute the dollars, right? So I've actually seen it firsthand. It's a discussion for a different day, but not exactly the cleanest form of delivering efficient dollars to where they actually need to go. Long story short is where we're moving towards is a value-based care system. That is also a discussion for a different day because it will take a long time. But these platforms, I get the idea, are consolidating and aggregating all this data so that they can come out with an AI counselor
They were already
based
trying.
on your expertise, the stuff that you went and paid $250,000 to $500,000 to go to school and take your tests and do all this stuff. They're learning from you to
Yeah.
create an AI counselor so that when people need counseling, they don't even have to pay the providers anymore.
Can I tell you the horror story that's going to derive from this? Because I already kind of I know from a couple different sources. I'm pretty sure where that's going. So yes, you're right. They're taking all that information from Headway, BetterHelp, Alma, and I guarantee there's somewhere in their terms and services agreement that it allows them to use this data, right?
Mm-hmm. Mm-hmm.
And we already see some AI counseling chatbots coming out. Their
Mm-hmm.
venture capitalists are already kind of putting that out there. Um, and so what I have heard is the most likely occurrence there is that we're going to actually see a kind of a triage in mental health as well, where people with more mild to moderate forms of mental health concerns will be you're sent to the chatbot, you know, in cases of a little bit more severe to moderate to severe. Okay, you're going to get telehealth with a live counselor though, good for you. And then the most severe cases may be then shunted to in-person counseling. So them getting to choose the method of delivery for counseling as well. But yeah, the AI thing is a big thing and it goes along with the data privacy things. And we could have an entire conversation on that. Um, I don't think we have enough time for that today because
But you just explained value-based care in mental health.
well,
And
that's
I
awful.
and I can confirm because Optum, they've backed off a little bit, but only because it didn't work right out of the box. But I know the other payers are innovating, trying to do the same thing. But I have the marketing collateral. I can send it to you. It's probably still available for free on Optum's website. I saved it down because what they explain is exactly what you said in their own words, in their own marketing collateral. It actually gives three different scenarios. Scenario A is, it's a fake person, but they put a name and what I'm saying. So like, I'm not giving away PHI, but it's Jane Doe, and Jane struggles with seasonal depression, and so Jane gets to use our amazing app to watch videos that are going to help her during because it's low risk. And then there's Susan Doe, who um, lost her job and is really stressed financially. Well, this is a life transition, so we're going to give her 6 months of telehealth because it's higher risk. And then there's John Doe, who was an alcoholic, drug abuser, was abused and sexually molested by his father as a child, has deep, deep, dark issues, and we're gonna pay for outpatient intensive in-person therapy for him. Right now, the problem, amongst many others, and I'm sure you can help me point out, but to me, is that is called risk scoring, which is already going
Hmm.
on in Medicare. But we, it just seems like it is not possible, nor fair, nor ethical to risk score mental health like that. Because I know people who have had very, very hard traumatic events who are mentally more resilient and healthier during certain seasons of their lives than maybe someone who is having seasonal
Mhm.
depression and who hasn't been molested or something really bad happened to them. And so, how is that fair when everyone's paying the same premium to say like, hey, yeah, it's just seasonal depression, so you just get the app.
And to go into that even a little bit harder, so there's a couple things. One, this person with seasonal affective um, depression, that can lead to suicidality.
Mm-hmm.
So if they just say, "Yeah, I get depression in the winter," and there's no discussion of that, there's no investigation of that, that can lead to some really negative outcomes. And so even that scoring, there's no way they're going to have that to a point where it is actually protective of the client. And to go even further into that, I would say that how often do clients give me all the information in their intake form about what they have going on? I can tell you it's maybe 30%. I would say with
If
about,
that.
if that, 70% of clients or more, I'll discover something in the discussion where it's like, oh, these experiences that you had during childhood, those were normal to you. You don't recognize that you were abused as a kid, or you were pressured in this relationship, or all these different things going on, or that the depth of your substance use, what it actually was, or what precipitated it and kind of led into it. There's so many times where we discover these traumas going on.
Mm-hmm.
And if we relied on them filling out check boxes, on the app to determine where they go, they'll never be discovered. I don't know how much you guys have been following the capabilities of large language models and generative AIs. Um, but if you can't stop them from, and excuse my language, making crap up
Mm-hmm.
off the fly, how can you possibly put a vulnerable person there interacting with them on the subject of mental health? Because these AI cannot discern truth. They only know to pull basically information from what they were trained on and to put it out there, but they have no sense of truth or accuracy. And so it's not like, the AI is meaning to lie to you. It's that it doesn't frickin' know.
And what's even, your point is actually deeper, but I want to remind you because um I did a lot in AI, self-taught. Part of my value prop to larger clients was to develop them to help them keep control of their data by developing AI models for them internally so that they could use their expertise for themselves rather than giving it away to third party.
Mhm.
Um, but I bring that up to say that a lot of people, I think, struggle to understand what AI is. And all it really is statistics, but the computing power has become so powerful that it can do this statistical modeling so fast and so efficiently that they can outperform humans in some degrees of reasoning. So I just want you to think for a moment. Let's use a very simple example. Everything to some degree, not the mental, not the spiritual, not the the motive, the heart motive, let's say for a
Mhm.
moment, but action itself can be defined in if, then, and logic, right? If Sean is hungry, then Sean goes to the refrigerator and eats an apple. If then,
Boolean script.
right? That's all AI is, just with massive decision trees. And what is unfair to you in your profession, now I can't prove it. I just think there's enough circumstantial evidence to show that this is what's happening based on what we've already talked about, is they are listening to your conversations, reading your notes, and stealing your intellectual property to train their models. So what happens
Mhm.
is someone types in the chatbot, right? It's actually very similar to predictive text. So like on my iPhone,
Yeah.
if you write the letter H in the iMessage, underneath it'll say hi, hello, hey. And that's because Apple was able to analyze all these text messages and say, hey, someone in the United States who speaks English, if their first letter is H, 99.9% of the time, they're either going to say hi, hey, or hello.
Mhm.
It's just decision tree logic. Um, but they're doing that same thing with massive computing power to say, okay, well, John Doe typed in this chat box and the keywords in his natural language are blah, 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 blah. Let it search real quick into our database of what all the counselors said the majority of the time to these
Yeah.
keywords. That's it.
Yeah.
And I bring that up to explain one, to try to take a little bit of the complexity away so that people can understand that, like, to some degree, AI is not this like scary thing that's hard to understand. It's actually easy to understand if you just take a moment. But number two, that it's only as powerful as the data that goes into it. And they're using your data that you paid good money for that knowledge.
And that's all over. That's also all over
And
the
that's
internet
all
too.
across industries. Yes.
Yeah,
Yes.
like that these AIs will also be trained on every article that's on Psychology Today and everything else too. And that brings issues in and of itself. But I feel like we could this could be another entire discussion. But one thing I just want to throw out there real quick is that with the use of AI also in these situations, so AI is never I'm going to get on my soapbox for just a second. I apologize. But AI is never going to point out the systemic problems which lead to many of the issues that people face. They will get, you know, there's some talk about how therapy sometimes um, individualizes and almost atomizes our suffering and the issues that we go through to being like, it's just your problem, right? And to me, good counselors and mental health professionals also point out the systemic ways in which people's environments are impacting them. Whether there's some sort of issues with poverty, there's issues with politics in this situation they're in, discrimination, all those different elements that people deal with also in their lives, and it points those out. And AI is never going to do that.
Well, and even more complex, Chris, than the ones you mentioned are those personal things.
Hmm.
Because we could kind of come up with some trends societally, but how do you take the uniqueness of the family you were brought
Hmm.
up in, with those five other characters there, those five other people? That's incredibly unique.
Yeah.
That takes it to like astronomical levels statistically of the uniqueness of it.
And to me, that's a separate but related issue, right? The thing is, the insurance companies are never going to, and things that are large organizations are never going to point to those larger systemic issues
Right.
because it's not in their interest to do so.
So let me ask both of you guys, what would be, so this is great, super background. What are things that from both your perspectives, one, the sort of more business perspective and from the counseling perspective, what are things that need to be done out in the field, or what are things that people should start doing in the field? Thoughts?
So my thought is, one, get educated. I think it starts there. Like, take some time to form your own opinion, because Chris and I made clear kind of where we stand on certain issues. I don't expect every single one of LPCs or counselors or people in the industry, advocates, to agree, number one. And so, for example, I had a very sweet woman reach out to me, and she felt just terrible because she used Headway. And I said, look, like, please don't take my words as somehow condemning you for using Headway. She was like, I didn't know all this stuff, and I said, look, like,
Mhm.
it doesn't make you a bad person because you use Headway. And like, there's already some people who probably are dependent in some ways on Headway. And if that's how you want to run your practice, I'm not here to try to take that away from you. I just want people to understand some of the some of the things that you're not being told so that you can make an educated decision on how you want to run your practice, what could happen in the future. Because one of the things that we didn't touch on that very quick, that's important, is when on these platforms you can only be an individual. So if you have desires, hopes, dreams of ever building your brand and expanding into a group practice, you can't get credentialed on Headway or Alma as a group practice, only as an individual provider. And
Yep.
so you're already constrained. But again, if this is how you make your living and you need to feed your family and you don't ever want a group practice, and then hey, like, I'm not, I'm not coming at you from a condemning standpoint. Just understand kind of the incentive and economic structure so that you can make the best decision for you for your long-term future, for the industry would be my first thing. And then number two, if you are someone who wants to remain more independent, I would suggest, and this kind of gets into like what I'm trying to do through my just $49 a month coaching program, is learn direct response marketing, learn how to attract your ideal client through having a specific niche, a very, very refined ideal client persona, a unique value proposition, and taking the time to learn the strategies and tactics of professional email marketing, of leveraging. As I'm not a huge fan of social media, but it is a free tool that you can organically market yourself if used correctly and appropriately. Learn those tools and strategies so that you're not wasting precious marketing resources, and using what's available to you for free or very affordable to attract clients to you so that you can have a thriving and sustainable practice.
Mhm. And so I would just throw on there to what Sean said is, yeah, I want to be very clear that I don't want to condemn anybody who is utilizing these platforms. You probably didn't know, who millions of people out there don't know, and that's okay. And some people also by necessity have to. And for some people, it's just going to work better. I think in the long run, it's not going to turn out well, when we cross that point where they start lowering the reimbursement rates, because in some ways, what I think they're trying to do is turn us into gig workers. Um, and so, but we can get into that another time. But what to do today, what you can do about any of these things, I'll agree with Sean, also become educated. So many of us are kind of siloed, I've noticed, in our either in our private practices or our solo practices, and we don't really ever connect with a lot of other professionals. And that um, kind of, again, kind of atomized structure to our profession leaves us vulnerable. Getting connected with other professionals, whether it's your state professional organizations, whether it's creating new ones to handle the new problems that we see. Um, Someone I know from Michigan, and along with some other folks, recently started what's called the National Alliance of Mental Health Providers. And they're trying to turn that into a national organization that is pan-professional. So it's counselors, it's social workers, it's psychologists, because there's no reason for us to be fighting turf wars right now, right? Um, there's enough clients to go around. There's enough sadness and struggle and anxiety in the world for all of us to see people, you know. And so there's no reason for us to be getting into interprofessional turf wars, but coming together and leveraging uh, you know, our intelligence, our creativity, our, standing in society as licensed professionals to really push these conversations out into the public awareness and to reach out to our legislators and let them know, like, we are paying attention to this. This is okay. And, or this is not okay, rather. Um, I think are really important things to do. And, I think joining state specific as well as national organizations is important because this battle is going to happen in both fronts, both in the state legislatures as well as the national legislature. And so become involved if you can, because I know we're all busy and I know we're all getting through life the best that we can and we're all tired, but giving anything that you can in terms of whether it's financial resources or just time. I can tell you as the president of Michigan Mental Health Counseling Association, the most valuable thing that people could provide a lot of the time is just their time and their expertise and knowledge. You know, um, because I think as we saw in 2019 here in Michigan, where we had a kerfluffle and there was a big response to it, counselors came out in force and we got things done. And if we can do that, there's still a way to protect ourselves from these venture capitalists and insurance companies and moneyed interests who, again, want to turn us into gig workers. But it relies on all of us taking that extra step. And I know it's hard. And I feel you on that. All of you, any mental health professional out there, I feel you on that. But we need you.
Yeah. Yeah. And the last thing I'll say is hopefully this isn't a big deal in Michigan, but make sure that you're vetting out and discerning your leadership. There's been I'm not going to get into the specifics. I wrote a newsletter article about it if you want to learn more, but there's been some people who are influential providers who have really been selfish in the way that they have portrayed their advocacy and were really more self-interested. And that doesn't lead to healthy conversation and healthy outcomes either. And so, I think this is pretty far and few between, but make sure that the people that you look up to, who you respect in your industry, who are your industry leaders in whatever geography region that you're in, are the real deal and are acting in integrity.